Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. My producer, Mr. Mark Groves. I'm your host, Cary Hall. Coming up this segment, we're going to continue our conversation with Bob Meyers, President and CEO of iTEDIUM. We've talked about benefits. We've talked about COBRA. We've talked about finding money. We've talked about a lot of things today. All this information is up on their website. If you even think you have an issue with any of these things, go on the website at iTEDIUM.com, ITEDIUM, iTEDIUM.com. All their services are up there. We're going to talk about one right now that is pretty interesting. It's called EESE, and I'm not referring to the Big Easy in New Orleans. Okay, I'm talking about this program that you've got that you've put in place now. You've worked on this for some time. This eligibility and enrollment program, which I think is amazing. Let's talk about how you handle that and some of the people you're actually doing it for. Pretty good sized entities, 120 some grocery stores in one group, the state of Kansas in another group,
state of North Carolina
in another group. So this obviously works. Let's talk about what you're doing here.
This has been a great product for us, and this is a great example. I'll shout out to Kansas because there was kind of a public-private partnership.
I remember when this started.
They were not happy with their enrollment platform, and they kind of picked through. They did a proposal, and they picked through all the different entities. And because we're a Kansas corporation, they agreed to partner with us to build this platform. We service 74,000 members across the state of Kansas and about 1,200 users, and we take virtually no phone calls. The state health plan does a great job servicing those members. We do all the enrollments, all the ongoing eligibility, births of babies, adoptions, marriages, divorces. All of that is kept in that system. And so their enrollment, as you know, is every year, as most large groups, around the October, November timeframe. We enroll 74,000 people in that timeframe. And it's a great product. It's the reason we picked EESE is Enrollment and Eligibility Service for Employees. And so it's a
great acronym,
It's a private labelable product. We don't want it necessarily to be an iTEDIUM thing. It needs to be theirs because it's them servicing that group. And they're trying to give them videos. They're trying to give them documentation. It's got a communications portal to it. It's got a billing portal to it. It is an extremely robust software, and we could not have built it without them. And it's really exciting because some of the groups that we have looking at it moving forward, it's a game changer for them and for us.
Yeah, because you're putting everything in one place, right? It's
Correct.
all there. So now it's open enrollment time, and I'm the state of Kansas, and I'm offering 5 plans to my employees.
And 5 health plans, 3 dental plans, 3 vision plans,
and a short-term disability plan, a larger
plan, life insurance. Don't forget all those.
Yeah, and so, but you're putting all that in this package.
Correct.
So now I'm the employee. I go up to the website. I click the health insurance. I see the different options available. There's an explanation that talks about what they are, or a video.
Right. Walks them through the whole thing, explains all the differences in the plans, the different options that they have. It'll save where they are. It'll give them a benefit statement when they're done. It'll inform them of, when they can expect their cards from the carriers. All of that sort of information is contained. Again, we did it from the benefits administrator's point of view. We're not trying to sell anybody anything. We're not trying to, make them experts on benefits either. We're trying to provide kind of need-based services to those employees and those retirees to make sure that they have everything that they need. They know they can come back at any time. They can log in throughout the year. They can check their benefits. They can look and ask questions. They can find out about changes. It's all really, really slick.
Okay, so let's go back to something, because this is one of the things that I see a lot of times that human resource directors have a real problem with. When it comes to ancillary benefits, short-term disability, long-term disability, all the rest of this, you have these quote-unquote enrollers who want to go out and sit down and enroll. What they're really doing is they're going out and they're selling this stuff to people. And a lot of human resource directors don't like this. A lot of human resource directors don't like their people being sat down and essentially, in their opinion, being pressured into buying short-term, long-term disability, life insurance, all these other things. What you're doing here is you're putting all that stuff on a platform with an explanation of it, and then the employee gets to go, I really should have some short-term disability. If something happens, I got a mortgage, I got car payments, I've got child care, I've got all these issues, and they can make a decision based on what works for them, yes?
That's exactly right. And you can give them proper contact information so that they go to that vendor and find out about the cancer insurance or find out about the disability insurance. Because you and I both know the HR people are typically overworked and understaffed anyway. They don't have all that information. They're not benefits experts. They're not trying to sell anything. And they certainly don't want to keep anybody from getting anything that the person actually needs. So that's absolutely right. We want to get them videos. We want to get them all the information they need in that portal to be able to make the decisions, not just at an open enrollment, but all year long. So that if they have a question in April and they want to look at their benefits and say, well, I could have taken short-term disability, I may take it at open enrollment, why not make that information available to them all year? It's really...
So if they want to start looking, this is interesting because, so now you've got a group where open enrollment's coming up, it's in October, but you can say to people, hey, it's September. You need to go up on the website now and look at the options that are going to be available this year. They're already loaded.
Sure.
They're already on EESE. All you got to do is go click it and look at it, and then you can start getting your head around what you want to do. If you want a short-term disability policy, if you want to upgrade your life insurance, whatever you want to do, that option, that information is going to be there.
It's very robust. It's very flexible. It'll interchange with our COBRA administration. It also, in the examples that we've built, we have over 100 carrier files that we transmit on a monthly basis. Most of them are on a daily basis so that we can tell the carriers who's changed, who dropped someone, who added someone, et cetera. And so it's very powerful in that regard. And the employer or the plan administrator can set those settings. And so if they want to make those benefits available all year, they can do what you just said. If they want to take those down and say, no, I only want to show them at open enrollment, they can do exactly as you said. If they say, well, I want to do leave of absence billing, they can do that through the system.
Wow.
If they want to do communications via email and text messaging to remind people, hey, we're having an open enrollment meeting about the flex plan next week. They can text them. They can email them. It is extremely robust.
Yeah, that's remarkable because the thing is, there are so many moving parts with these employee benefits programs now. There are so and there's so many things that people have to consider. And you've got as you said, overworked, overburdened human resource people that all this stuff is coming into, and they're trying to deal with it. This obviously frees up the human resource people to deal with issues they really need to be dealing with instead of this stuff.
It tremendously frees them up, and it gives them tools because we've got full complement of reporting. So you can see how many people took each plan. You can see how many people are participating. You can look into the reconciliation if there's a question and someone shows up on 2 plans. All of those things are now at their fingertips in one system. Not the problem with the enrollment systems that we saw was you have every enroller trying to give you their own system. So you end up with 5 systems instead of 1. This is a one-stop system that'll do all of it.
Pretty amazing. The system is called EESE, EESE. It's all part of iTEDIUM. Bob Meyers, thank you.
Thank you, Cary Hall.
We pumped out a lot of information.
Yeah, we sure did.
Today. The website is iTEDIUM.com, iTEDIUM.com. You can go to the website. Anything you need to know is up there. Contact them. They will be happy to help you. You've been listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.